Hey, Dr. John Alexander here. I wanted to talk to you a little bit today about the deep plane. This is one of the questions we're getting a lot of these days. It's really a buzzword on the internet, and anybody who's looking into facial rejuvenation wants to know what the deep plane facelift is, because that's really what's getting the best results. There's a lot of techniques out there. I've done them all, but in my opinion, by far, this is the best way to get the most natural appearance you can to the face and really look like you've just gone back in time. Doesn't look like you've had anything done. You just look like a younger version of yourself. Now, we all know that in the back of our hand, there's no fat. When you pinch the back of your hand, there's only skin there. But when you pinch your face, it's actually thicker. And what you're feeling here is the fat that's in the face. If you're thin, there won't be as much there. If you're a little chunkier, it'll be thicker. What I like to use is a Post-it note. This is really helpful for demonstrating how the face ages. Simple Post-it note here. There's a thick pad and a thin one. If you're a thin person, you're probably built more like this. If you've got a heavier face, you may be built more like this, but it's the same surface area. This is not very big compared to my head, but if I lay it on my cheek, you'll see that that covers my entire cheek. When we're young, the fat of our face sits up high. This would be the angle of the mandible. This is where it falls along the nose and the mouth. It sits very high up under the eye and helps fill in the orbit. And the back part of the square builds up our jawline to create a nice shadow under the jaw. Now this fat's not very heavy. Just like this Post-it note, probably weighs less than an ounce, but gravity is still gonna work on that, just like it would anything else. And so as we age, the structures that help hold that fat up in our face get looser. And when we stand upright, gravity will pull this down. As this point of the square breaks the jawline, that's where we begin to see a jowl. And the lower this gets, the heavier we get in the nasolabial fold and marionette line. We also get more hollowing of the lower orbit as this drops, and our jawline is not as pronounced. Now, a lot of people think that aging is caused by wrinkles, sun damage, that we lose fat in our face. But the main thing that makes us look older is that this fat is sitting too low. So I want to show you this video. It's really cool. I found it online, and it's a video of a 20-year-old woman in the back of a fighter jet. And she's going around a very sharp curve, which is probably creating about 6 G's on her face. So it abnormally pulls the fat of her face lower. And as you watch this video, you can see her start to go around this curve. She begins to almost pass out because of the G forces. And you can see right here, I'll pause it for just a second, that she looks like she's a 60 or 70-year-old woman simply because the fat of her cheek is sitting so low on her face. Now, I'll start it again. As she comes out of the turn, you'll see that the gravity comes off of her face and her cheek fat goes right back up where it used to be, and she immediately looks like she's 20 years old. So that's the beauty of the deep plane lift. If you can take a patient whose fat is sitting lower and simply free that fat up and move it back higher up onto the face, they will instantly look 10, 15, sometimes 20 years younger. Now this is really easy to demonstrate. You've all had this experience. When you go to take a selfie, you turn your camera on, you flip the camera around so you can see yourself. If you're over 30 or 40, you're often shocked that you don't look as great as you think you should. And so what do? You don't hold the camera down here because that's gonna make you look worse. Everybody always will take the camera and they'll hold it up higher. And they think that when they're holding it up higher that they're seeing a better angle of their jaw. But what's really happening is the higher you hold the camera, the more gravity is taking the fat of your face and moving it back up to a higher position. So you can see what you used to look like when you were younger. So imagine this, when we're hanging down, this fat is loose, it's looking terrible. When we're neutral, it's about here. And when our head leans back, this slides back up into its youthful position, and we look a lot younger than we used to. Now, is this a new procedure? Well, yes and no. For over 30, 40 years, doctors have been trying to figure out how to get this soft tissue to move up into the face. There's basically 4 steps to any facelift, and no matter who's doing it or what they're calling it, there's gonna be these 4 basic steps. The first step is making incisions, which works like a seam, so that you can get into the face and do what you need to do. That's step number 1. Step 2 is that you have to loosen some of the skin so that you can get access to these deeper structures. Step 3 is the step that involves moving the soft tissue around, and there's a lot of different ways to do this. This is the most variable step, in facelift surgery. And it's really important to know what the doctor is doing during this step. Now, just a word of caution, because this is such a popular technique these days, many surgeons are claiming that they're doing a deep plane procedure, and they're really not. They might be doing something to this layer, but they're not actually working on the deep plane. Sometimes people will just create a fold in the deep plane to make it tighter, but those sutures that hold that tightness together tend to come loose in just a few months, and you can get recurrence. The difference with the deep plane is that you're getting underneath this entire pad of fat and releasing a lot of the tight fibers that hold this down. And when those are released, this moves completely up back where it used to go. So the deep plane raises this entire bulky fatty tissue in a safe way where it disconnects all of the tight fibers and allows us to reposition back where it used to go, to sew it down and have it adhere to its younger position, and then everything extra can be trimmed away. Without a doubt, this is by far and away the most effective, predictable technique out there to make an aging face look younger. It'll sometimes be so effective that when we look at the before and after pictures, it looks like you're looking at a mother and a daughter. If you're looking at rejuvenation, it's important to find somebody that's doing this technique on a regular basis. It's very, very impressive what it can do for you. And I recommend that you come in and have a chat with us and see if you'd be a candidate for this type of procedure. Been great chatting with you. Thanks.